Children are waiting in emergency rooms for mental health support more than ever, with the situation being described as a national crisis. One Nova Scotia mother refused to leave the hospital until she got help for her 10-year-old son. That was a conversation we were having last week. Our next guest says she's not surprised by that news. Cheryl Boswell is the Executive Director of Youth Mental Health Canada. Joins us in studio now. Cheryl, good to have you with us today. And a very important conversation to have.
Yes.
I want to ask you about a report published last month by the Canadian Institute for Health Information, and it found this. There has been a 65% jump in mental health-related hospitalizations, and we're talking about people from the ages of 5 to 24. Why aren't we equipped to handle this?
Yeah, it's. I think the stat raises a lot of questions. It's for me, I'm asking myself, well, are we? Are there more inpatient beds? Are we responding in an effective way? Are we listening to families? Are we not supporting young people with mental health challenges so that they intensify and they need hospitalization? Are we listening to people on the front lines of mental health, so families, and providing the needs-based kinds of supports that are necessary to help with healthy functioning so that we are not looking at hospitalization?
We were covering two stories last week, one of which was the one I just mentioned with that Nova Scotia mother, and another mother who was talking about her young child trying to set herself on fire. And this young girl was 4 when they noticed that her anxiety issues were quite severe.
Yeah.
When I'm listening to these stories, I'm thinking about my own children and thinking, if I were in this situation, would I know what to do? Where do you go? What options do parents have?
Yeah. I think, there was such an outpouring from this story from Nova Scotia. Families everywhere in Canada sharing the same horrific stories of waiting for hours and being told there's nothing available. And I think, all services, whether it's family doctor or healthcare or mental health care, are saying after 5 p.m., go to your nearest hospital, ER department, if there's a health crisis. So families are talking, and they're told if you need support, if you need services, go to emergency. And then people are alarmed if it happens. And what happens is people wait for hours and then they're told that nothing is available.
And why is nothing available? They don't have the resources to have somebody there?
I think that, it's an extreme sort of thing. We need a lot more community-based accessible programs. So after 5 p.m., if it's the only place to go, if you have a health crisis, then we need to look at that and say, we are not providing for the needs of the community. So we need things like community-based mental health clinics with respite centers. We need to extend our notion of community centers just focusing on physical health and broaden it into mental health as well, mental health and wellness programs. The use of mobile units with compassionate responders for children and youth, and no police involvement. It's not a criminal activity to have a health crisis. It should be compassionate responders going into the home 24/7. So it's even if there is access to mobile units, it's very hard because they aren't 24/7 available everywhere.
And that's the thing, right? Because you never know when something's going to happen. And you just want to be able to have the resources and something available that if you are in a crisis, you're not sitting in an ER refusing to leave for 12 hours.
Yeah, and as you said, as a parent, you want to do the best for your child. And that's what parents are doing.
And I feel like that's really it, right? Because as a parent, when you feel like you're failing as a parent because you don't have the support or the resources, that is a terrifying feeling when you feel a little bit out of control.
Well, and when your child is talking about, suicidal thoughts and feeling hopeless and despair, and they, parents are doing the right thing, looking for supports for their children, and then they're, young people are shamed. They don't have enough skills to cope with life or school, and families are told their parenting is to blame. And
it's just a cyclical thing, and it's a conversation that we all, of course, need to keep having. Cheryl, we appreciate your time.
Thank you
Thanks
very
so
much.
much for being here.